Hi, I'm Megan Kmiotek, COO of Know Polyhydramnios. I'm so excited to be here today with Tiffany Young, our CFO, CEO,
Yes.
co-founder, all of the good things, and with Jessi Beyer, who is a number one best-selling author, trauma author. She is a mental health advocate. She is all of the great things that we've been working on at Know Polyhydramnios to focus on. And we're hoping today she can help a lot of our moms. We've been wanting to go into this self-care area, arena for a lot of moms who've been through some trauma that polyhydramnios can bring, as we all know too well. So we're so excited to have Jessi here to help focus on some of the areas that us moms could use some help in. So we hope you will take away some great suggestions from her remarks and to better care for yourself and your family and your work and your life. So with that, I'm going to let Jessi introduce herself. So Jessi, we're so excited to have you here today. Thank you so much for being here.
Yeah. Oh my gosh. I'm so excited to be able to do this and share some hopefully good wisdom with your community and help them through what can be a really difficult time. So a little bit of background on me. I have been involved in the mental health space ever since high school with my own mental health struggles. I did study psychology in college and grad school, and I'm really passionate about helping people find a path to healing that is the right fit for them. For me, when I was healing from trauma, I'm not a mother, but just from my own trauma that I had in my life, I went to one day of talk therapy, and I was so uncomfortable with it that I quite literally ran out of the building and I never went back. And so I did a lot of my healing journey completely on my own with my own resources, my own brain power, energy, emotion, tears, all of the things. And when I learned about some other different methods of healing out there, I was like, oh my gosh, I have to share this with people so they don't have to go through that same journey alone. That all kind of brought me to where I'm at today, which is the author of How to Heal, Megan, like you said. I'm a speaker on mental health as well. And also this spring, yes, that book right there. And this spring, we're actually launching an awareness apparel line. So you can literally wear your brains on your sleeves and help raise awareness for mental health and break down that stigma. So yeah, in a nutshell, that's who I am and what I do.
Jessi, that's amazing. We are so excited that you're breaking into this like awareness, this area, and to like do way more than talk therapy. That is what we're looking for today. So with that, I am going to hand it over to Tiffany for our first question, but thank you so much for your introduction and for all the hard work you're doing for this arena. Thank you.
Absolutely.
Yeah, totally agree, Jessi. This is amazing. We're so happy that you're doing this with us. So I just, before we jumped in, wanted to say I bought your book and I started reading it. I'm not too terribly far in, but I'm far enough that I absolutely love it. So one of the things that Jessi talks about in her book here that I just think is priceless for anybody out there wanting to get this is that trauma is like individualized to each of us. It's not just one standard, like you have to have this happen to you for it to be trauma, or that some things can happen that I might think is trauma and Megan might not. And I really love that you talk about that and make it so individualized. And I also really, really love how you talk about that comparing our trauma to somebody else's trauma really can rob you of your own healing journey. That was so eye-opening to me. And I really feel like that's like a foundational thing. Did you have anything you wanted to add about that? I'll let you.
Yeah, absolutely. Well, this is something that I see a lot is people will come up to me, whether it's over Instagram or in person after a speaking event, and they'll share their story. And in my brain, I'm thinking, oh my gosh, this is the most heart-wrenching thing that I've ever heard. Like, my God, you have so much trauma in your life. And then they'll finish it with, oh, but I know that other people have had so much worse, so I don't want to seem like I'm complaining. And that just breaks my heart because we've created a culture in which you have to categorize your pain. We have to look at the three of us in this Zoom room and say, okay, Megan, you've had it worse. So you get all of the healing resources, you get all of the empathy. And Tiffany, you and I are on our own. We don't get anything because our trauma, our story isn't bad enough to get any of those resources. Not only does that harm us, Tiffany, and anyone else who does this to themselves, because we're invalidating our own experiences and our own story, but it also doesn't really help the person you're comparing yourself to. Because in essence, what I'm saying, I'm looking at Megan and I'm like, oh my God, your life is horrible. Have you looked at yourself lately? Because you've been through so much. Your life is a mess. And that's not helpful to Megan either, right? Having that comparison, it's no one. It robs people of healing resources. It robs people of their own validation and their own ownership over their story. So I'm so glad that that's something that stood out to you, because that's a conversation that I have with a lot of people who get into that place of, oh, I know someone else had it worse, so I don't want to feel like I'm complaining.
Oh yeah, I do. I see that. I see that in my own life. I see it in people too. Yeah.
That's so eye-opening. I mean, it's like, I do that, you know, and I am like hurting my own self, right? Like saying it's not that bad. Yeah. I love that.
Yeah.
What a good
Absolutely. And I still do it too. I mean, I'm not saying that I'm perfect at any of these things. There's definitely times where I'm having a bad day and I do the whole, yeah, but you have a roof over your head and you have gas in your car type of thing. And it's like, that doesn't help my depression or my anxiety right now. Like, my having gas in the car is not contributing to my mental health in any way right now. So yeah, it's just so important that, you know, you have ownership over your own story. You validate everything that you've been through. And it really doesn't matter how that stands up in comparison to anyone else's experiences that they've been through.
I love it. I love it.
Yeah, I love that too. That's so good.
So we have some questions. So a lot of a common theme within polyhydramnios is sort of like, you know, you're diagnosed with this big thing, and then you're sort of sent home with no real knowledge. You know, we're not doctors. You know, Dr. Google, most people have the awareness is probably kind of dangerous, right? So we have this unexpected news and this fear of the unknown, because we don't know what's coming down that pipeline with what polyhydramnios really even means. You know, if you tell anybody on the street, oh, I was just diagnosed with polyhydramnios, they'll be like, what is that? And, you know, how can, you know, us patients deal with this unexpected news and this like fear of the unknown coming, and sort of prepare ourselves and handle the news in a calm way, and help navigate through those waters?
Yeah, absolutely. So a lot of times what I see in people when they get some type of unexpected news, like a polyhydramnios diagnosis, is they go in one of two places. They either go to catastrophe, and they're like, my world is over. This is the only thing that I can think about. I have to focus on my energy on this. And what if it goes wrong? And that kind of catastrophizing of the diagnosis. Or they go in the other direction where they're like, it's fine, everything's fine. I'm going back to normal. It's going to be great. It's going to be good. We're not going to talk about it. And neither of those are really helpful, because in neither of those situations are you giving yourself an opportunity to just sit with that feeling and accept and even understand, okay, what are my reactions to this right now? What am I scared of? Not every little tiny thing that Dr. Google says can go wrong, and not, oh, I'm good. I'm just going to push through. I'm going to be the strong stoic type. But what am I feeling about this? How is this scaring me? What specifically am I scared of? How can I breathe in this moment? And then from that place, you're able to actually access any resources that you have in your life. When you're so focused on the catastrophe, or you're so focused on being strong and powering through, again, you're cutting yourself off from any resources that you may have, whether that's calling your doctor back the next day and saying, hey, you know, I've had some time to process this. I don't understand X, Y, and Z, or I have questions about this. Can we have a chat about this so I can better understand what's actually happening in my body and in my life? Maybe it's calling a friend. Maybe it's calling someone from your community who you know has a similar story and saying, hey, this just happened. I need some support. Maybe it's taking time with your partner and having that discussion and saying, this is what I'm feeling. This is what I need. But all of those resources are available to you as someone who has just received this diagnosis. But when you get into that place, like I said, of catastrophizing or of just powering through, moving on to the next thing on the task list, you're preventing yourself from accessing those resources. So in a roundabout way, my answer to that question is give yourself that opportunity to process. Don't bury it, don't blow it up, but what am I feeling right now? How can I acknowledge that? And then what resources do I have available to me that can help me mitigate that stress and move forward with as much confidence as you can have after a diagnosis like that?
What great advice for us to like keep that clear head and work through the emotions and be able to process, and then ultimately maybe go back to our doctor once we've like processed. I love your suggestions. I think they're so helpful, and wish I'd known them, you know, like 2 years ago.
I was thinking the same thing.
Absolutely. And it's not one of those things where I'm like, oh, just keep a calm head. And then you keep a calm head. Like that can be really hard. And maybe you need to go scream into a pillow and then you can have a calm head. But giving yourself that time and space and letting yourself actually work through some of those emotions, that's going to be the best thing for you.
Yeah. And knowing that it's okay if I'm feeling all the feels.
Yes, absolutely. 100%. And it's reasonable that you're feeling all the feels, because not only do you have all of the hormones in your body from pregnancy, but also you have this fear for maybe your life or your child's life or what the rest of your family is going to experience throughout this. So my gosh, if you're not feeling all the feels, like that's probably a sign that we need to have a conversation as well.
So true. That is so true. That is great, Jessi. So that kind of leads us into the next question that I had is, so a lot of women who get this diagnosis, they may come from a very active background, like Megan is a marathon runner. And not always, but sometimes we find women with this diagnosis who end up getting put on bed rest, or they need to take a break from so much activity because I mean, it can be dangerous, like where, you know, more susceptible to placental abruption or your water breaking early. And so what advice would you have for somebody whose normal coping mechanisms get taken away from them in a situation like this? Like Megan, she couldn't go out and run, you know, her 26 miles whenever she wanted to all the time anymore. And that was the thing that was bringing her joy in her life or helping her mental health. That makes sense.
No, it totally does. The first thing that I wanted to share is that this can feel like a grieving process. I don't know if either of you experienced that with your diagnoses, but when you get a diagnosis, any diagnosis, it could be cancer, it could be polyhydramnios, it could be anything where your life is dramatically disrupted and you no longer have access to the activities that you like to do or the ability to do those activities, that can feel like a legitimate grieving process. You're going to go through the stages of grief. There's going to be the denial. No, I can, I really can. There's going to be the anger. Why did this happen to me? There's going to be all of those stages. And again, the first best thing you can do is give yourself permission to grieve. Again, I'm not a mother. I have not had this diagnosis, but I imagine that some mothers might be like, this is ridiculous. Like, I shouldn't be so upset over this. I shouldn't be grieving over this. Like, I didn't actually lose anyone yet. It is a loss. It's a loss of your routine and a loss of your life as you knew it, not to be so dramatic about it. So the first thing is honoring that. From a very logistical perspective, a couple things that I would suggest are, number one, are there ways that you can modify your activities to still kind of be able to do them, but not to the same degree? So for example, Megan, again, I'm just using you as an example because you're sitting here in the room with us, but for you, you know, could you take a lawn chair and go sit outside in the park where you like to go running? You're not going to be running. It's not going to be the same, but you're in that space that brings you joy. You're outside, so you're getting the benefits of sunlight and nature and green exposure. If maybe, for example, someone really likes swimming or wakeboarding or surfing or something in the water, can you go sit in the water? Can you go sit by the water? Can you have a fountain in your room that's playing sounds of water? Again, getting creative with these different ways of incorporating the maybe more emotional elements of the activities that you like to do into what you are physically capable of doing right now. Maybe there's some women when they get this diagnosis where, you know, they can't run 26 miles, but they can go on a walk for 2. And so, yeah, go on those walks as frequently as you can. Find ways of incorporating that into your life while recognizing that it's not going to be as good and it's not going to be enough as it was before. So a combination, to kind of wrap up everything I said, of acknowledging that grieving process, not berating yourself for that, moving through that process as like it was a literal loss, as well as finding ways to incorporate some of the places or the activities that you used to enjoy into what you are now capable of doing.
I love that. I did actually start to take a yoga mat outside just to get the vitamin D because, you know, my own personal happy place is just like being outside in the fresh air. So, you know, I like realized how much the depression was seeping in on me just laying on the couch and that I couldn't just do that anymore. And all I was capable of doing is just like walking to the outside. So that's what I did. And so I think, you know, pushing women to figure out ways to modify, you know, what they are happiest doing. I think it's such a great suggestion because it was probably one of the most helpful things to me once I realized like, oh, maybe if I just go outside, that would make a difference.
The other thing that I would add on to that is make sure you're getting alone time as well. And that seems kind of weird. You're like, I'm already bedridden and now I have to be alone. But when you are in that space, if you have a supportive family around you, like hopefully all of the women in your community do, that can sometimes be a lot, because you're sitting there staring at these four walls and that's all that you can stare at. And here's your husband or your partner going in and out, going to work, going to the gym, coming back home. Do you want some food? Here, let me take that dish for you. Maybe if you have other children, they're trying to play with you, but they don't really know how to play with you. There's a lot going on around you while you are in this one spot that you can't leave. Again, if you're completely bedridden in this situation. So finding a space to say, I need to be in the backyard. I need no one else in the backyard with me. I need to have this peace and quiet where I'm not seeing literally everything that I'm no longer able to do in front of me happening without me. That can be really good for your mental health as well, just to have that space to breathe and to say, this is where I'm at right now. This is the environment that I feel good in. And I'm not going to stress myself out by watching my husband or my partner do all these things and my kids do all these things that I cannot do with them right now.
That's brilliant. I absolutely love that idea. Yeah.
Super helpful. So that sort of takes us into, we've talked about these areas of like what we can do when we are feeling some of the depression. And so I want to talk a little bit now, like, we talked about how we might be denying ourselves to feel these things and disvalidating ourselves, saying like, oh, it's not that bad. So, and I think that's probably a common theme, at least it's a common theme between me and Tiffany, and you said it, Jessi, so it's probably a common theme outside this room. So if we're denying ourselves of that, what are maybe some good warning signs that, us women can see that maybe that experience is affecting us a little bit more than we would have liked to have admit towards, even myself, I think I was like, well, that was a difficult pregnancy, but maybe it was more than just a difficult pregnancy. Maybe that really was trauma for me. I live and breathe running. I live and breathe activity. And like all of a sudden, all of that was cut off from me. Like, that was unexpected. I could say that much. And then all these fears of my child. So, what are signs that it was more than just a difficult pregnancy, and where do we go from there once we can acknowledge that?
Yeah, absolutely. So the things that I'm going to share over the next couple of minutes are by no means an exhaustive list. And so I want to start by giving a very broad answer, which is that if there is something that you are feeling or experiencing that is concerning for you, that is enough to warrant going and speaking to a therapist, going and speaking to a doctor, doing some more digging about this. There is no exhaustive list of, okay, you have these 17 options for things that, could be going wrong. And if you don't have one of these 17, then everything's perfect, because it's a spectrum. And like we said earlier, everyone experiences things differently. So my overall overarching broad answer is, if you are feeling a way that is concerning to you and is affecting your ability to live life the way that you want it to, that's a sign that you need some level of support in that instance. That being said, some common things, irritability. If you have a really short fuse, shorter than normal, if you're sleeping too little, if you're sleeping too much, if you're having nightmares about your pregnancy, if you are avoiding things related to pregnancy, so avoiding going to the hospital, avoiding your friends that have babies, avoiding your friend's baby shower, whatever that may look like. If you are feeling hopeless about the future, that it's never going to get better. If you are having a really hard time finding enjoyment in anything, especially things that you really felt enjoyment in before, if you're finding yourself catastrophizing everything and getting really anxious and stressed about letting your children out of your sight, or letting your husband drive to work, or your partner, again, anyone in that spectrum there, those are all signs that something might be out of balance, right? And yeah, having some anxiety about your husband driving to work if he got into a car crash last week, probably valid, right? But if that's prolonged, if it's continued, if it's more than just, I had a really bad day today, but tomorrow I'm feeling better, I'm back to normal, we're good. If some of these things are prolonged, if they're to the level that they're concerning you and again, affecting your ability to function in life, those are all signs that there might be more going on here. With trauma specifically, what I kind of love about the world of trauma, and that sounds weird to say, but it makes it so unique, is that trauma is also a very somatic experience. So things like depression and anxiety, bipolar disorder, things like that, a lot of them live up in your head, but there's a very, very real part of trauma that gets stored in your body. And so when you're looking at healing from traumatic events or traumatic time periods like a pregnancy, not only do you have to address the psychological component, but you have to address that somatic physical component and release that in order to also completely, fully heal from trauma. So with that in mind, if you find yourself feeling pain in certain areas. I mean, it could be as random as your knee, right? It doesn't have to be anything related to your anatomy that carried you through the pregnancy. But if you're feeling pain in an area, if you're feeling a weight or a weird pull in an area, additionally, if your body is reacting to situations that maybe your brain is not. So for example, again, not a mother, so this is not a pregnancy example, but when I was in high school, I was in a very traumatic relationship. And there was a period multiple years after I graduated high school where there were some things coming up logistically regarding my relationship with that person when I was in high school. And when I was dealing with this situation, I was sitting in my bed at home. So I was totally safe. There was nothing that could hurt me. I was totally, totally fine. And my body was reacting like I was falling out of an airplane without a parachute. I was physically shaking to the point that I was almost convulsing. I felt sick to my stomach. I was sweating. I was pale. My body couldn't differentiate between this is a memory, this happened in the past, versus this is happening right now and you are in imminent danger. And so if you have any of those reactions in your life where maybe every time you drive by the hospital, you get really, really shaky and you're like, we're in the car, what's going on here? That could be a sign that your body is holding on to some part of trauma that is triggered by driving by the hospital, which may have been a very traumatic place for you. So that was a very long-winded answer. The short of it is that there are a lot of different things that could be cause for concern, but pay attention to some of those somatic feelings, especially if you're concerned that it may have been a trauma, that pregnancy for you.
I was taking notes because it was just so eye-opening. It's so helpful.
Me too.
You're so insightful and breed so much awareness for us. These are things that we might bypass. It's just like, oh, I don't know, I was feeling anxious. That's weird, but like have no idea that it has a much deeper meaning, And so Tiffany, I think you are up next.
Yeah, so much so. I love that answer, Jessi. I had no idea about holding the trauma in our bodies. Like as you were saying that, I'm like relating back some of the things that happened to me after I had my baby. And just like, yeah, I'm totally linking that. Like I refused to go back and see my OB afterwards. It made me feel like shaky and jittery and like overly upset when I was nowhere near the hospital and not in danger, like you're saying. That's so crazy. So our next question is kind of the opposite of that one. So what if you did go through something that maybe other people might label as a traumatic experience? For instance, maybe so I had 2 pulmonary embolisms after I had my baby, blood clots in my lungs, and they almost killed me. I definitely was traumatized by that. I had a major reaction, but there have been other women who've been through that and didn't react at all. So it wasn't traumatic for them. How would you talk to people like that maybe are feeling the pressure from outside sources that, oh, you went through all of this, like you should be reacting more than what you are?
Absolutely. I'm so glad you added that last bit because I was going to go there. So there's really 2 things that I would say. Number 1 is give yourself internally permission to not be traumatized. Trust me, being traumatized is not a goal to aspire to. If you are not traumatized by something, take the win, my friend. But in all seriousness, you do have to sometimes have that conversation with yourself and say, yeah, this pulmonary embolism, this was hard, but I got through it and I'm okay. And I'm really honestly, truly okay about that. Ask yourself, am I honestly, truly, really okay about this? Because if you're using that okayness as a way of masking symptoms of trauma, that's a whole nother discussion. But if you really are like, yeah, you know what, I am okay. I really, truly am. You need to give yourself permission first to be okay. The second part is about managing some of those conversations, because you're right, Tiffany, a lot of times if you are not traumatized by an event, that pressure to be traumatized by it is going to come from really well-intentioned friends and family members who are checking in on you. Are you okay? Wow, that was so much. What can I do to help? How can I be there for you? And so having conversations with them and letting them know what you need and what you don't need in a situation is really, really important. The way that I like to have those conversations is a very simple 3-step structure. So the way to start is by saying something nice to them, because we all know that if I come up to you and tell you all the things you're doing wrong, that conversation's going nowhere fast. So when I can go up to a friend or family member and say, hey, Bob, I am so glad that you care so much about me and my pregnancy, that you want to support me. That really means a lot to me. And I'm so thankful for your care. Now, Bob is like, yeah, of course. Yeah, no worries. Of course, I'm here for you. The second part is you want to be very specific about what's not working. You don't just want to give a broad statement and say, Bob, you're doing everything wrong, because that's, again, not going to go over well. So something along the lines of, Bob, I really appreciate your support. Right now, I'm really feeling okay. And having you ask me every single time you see me how I'm doing makes me feel like I should be feeling something that I'm not. Now Bob knows, okay, this specific thing that I'm doing is not working for Jessi right now. The way that you want to end that conversation, the third part, is by telling Bob specifically what to do instead. Because if you just leave it with, okay, you're doing this thing wrong, maybe Bob's going to try something else and that's not going to work either. And now you're going to get frustrated. And now Bob's frustrated again. So he tries something else and we just get into this cycle of no one knowing how to fix the situation. So ending with something like, instead, Bob, how about you write me a letter every month that just checks in and sees how I'm doing. And then that'll give me a chance to ask for help if I need it. Totally spitballing there. Whatever you need in that situation is what you want to share.
Brilliant.
But by going through that process of, thanks so much for your support. This is what's not working, and this is what I need from you instead. That's going to help you get what you want, but it's also going to bring this person into your team in a sense, in a way that actually works for you. So those would be my two biggest tips for women who are finding themselves in that situation.
That is so helpful for so many different reasons, because I think some of these women who have gone through this from start to finish, there is people offering help in so many different capacities, from the pregnancy to the, post-pregnancy and all the way through, with whatever's going on with their children on the other side. So I think that asking for what we need and being clear about it and setting boundaries is could be useful in so many different capacities. So I love those steps, and I love all the suggestions.
Thank you.
So with that, I want to go into another question. We've talked about a lot of in-depth things here that I think can be serious in certain regards, and so I want to be clear about where, how, when, and should someone seek help, professional help, and above and beyond, we want to make sure our women are taking care of themselves. So please fill us in about when and where and how to get help.
Absolutely. So I am a big believer that everyone can benefit from therapy. And I will be very upfront and say I go to therapy every single week, even though right now I don't currently have a diagnosable mental illness. But I love that level of support. I love having her in my life that I can bounce things off of and learn from and grow from. So falling back onto the answer I said earlier, if you have anything in your life that's concerning you, feel free to go to therapy. To give a more direct answer, I think if you're finding yourself in a place where you're not getting what you need from your peer support systems, whether that is your OBGYN, whether that's your partner or your friends, if they're trying, but you're still not feeling like you're supported and you're getting what you need, it might be time to bring in a third party person like a therapist, someone who is not intricately involved in your personal life and someone who is especially trained to support the mental health of an individual through something that's traumatic for them. There are lots of different types of therapy out there. There are lots of different therapists out there. And what I will say is that sometimes it can take multiple tries to find the right form of therapy or the right person to work with. Again, for me, the first person that I saw was not a good fit to the point that I ran away, quite literally. And I'm sure she's a great person, right? I'm sure she's helped a ton of people. She just was not the right fit for me. And at the time, I didn't understand that I could try a different therapist. I could try a different type of therapy. I thought, well, this doesn't work for me, so I gave it a shot. So what? It's not going to work. So if you find yourself, you try a type of therapy, you try a therapist, you're like, I don't vibe with this person. I don't like them. We're not clicking, or maybe this isn't the right type of therapy for me. Please, 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 please continue to try to find a different person to work with, because when you find that right fit, it is the best thing in the world. I'm so thankful for the therapists that I've had in the past. In terms of some different types of therapy, we did talk about talk therapy earlier. Talk therapy is fantastic. It works for a lot of things. It's a great entry point. It's very accessible for people, and it's almost always covered by insurance. So if you want to just try something, that's going to probably be your best fit. If you're looking to get into more types of integrative therapies, which is kind of my area of expertise, there are lots of different options. I do cover them all in my book, so you're welcome to check them out. But just to kind of highlight some up off the top here, if you enjoy working with animals and you find that that is really healing for you, equine assisted therapy and canine assisted therapy are fantastic options. If you find that movement is really helpful for you, and this, you know, given the nature of polyhydramnios, might be more relevant after you give birth, but movement-based therapies include trauma-sensitive yoga, dance movement therapy, things like that. If you really enjoy nature, I know Megan, you said nature and being outside was really important for you. Things like ecotherapy and flower essence therapy are fantastic options. And if you're looking for something that does a little more work on the mind, EMDR, which stands for eye movement desensitization and reprocessing, very long-term EMDR works if you're looking to find someone. That's fantastic for reprogramming trauma memories. And then if you're looking for something that's very somatic, craniosacral therapy is another great option. Additionally, mindfulness and meditation are fantastic for trauma healing, not in the sense of, you know, having a spiritual experience or anything like that, but allowing you to train your brain to come back to present, so that if you are triggered or you're having a flashback or something, your brain, just like a muscle that you train at the gym, already knows how to come back to the present moment, which makes recovering from those types of events easier and faster. I'm going to pause here. I'm happy to go deeper into any of those therapies, but just off the top, those are some other options besides talk therapy for people to explore.
Yeah, thank you.
Great. Yeah.
I do too. I was going to ask you to share some of those and you did it. So I'm going to throw another plug in here for Jessi's book, because you talk about all of these in your book, don't you? Yeah, all the different types.
I do. Yeah.
And that's great. I was one of those people, I didn't know or realize there were so many different kinds of therapy, which is actually ridiculous, because when I was in college, I assisted with equine therapy for children with special needs. And I never even equated that to trauma. So it's really amazing. Okay, let me see what other questions we have here. So moving on to the postpartum part of our pregnancies, a lot of times we don't actually know the nature of what caused us to have polyhydramnios until after the delivery of our babies. Some women find out within that first year. About 2/3 of women will find out. Another third of them might never ever find out. And so our first question is really geared towards those women who have their babies. They have a beautiful birth, labor and delivery, no complications. Their babies are born with no problems. They don't spend time in the NICU. They go home, and a year later, these moms have healthy toddlers, no extra doctor visits, nothing's going on, but they feel a sense of resentment. Like, I was so worried during my pregnancy. I had so much anxiety. I feared everything. Like, it robbed me of my joy. I'm so mad about it. I wish that I had never even heard this term. You know, like, do you have any advice for these women who go through that? Because I feel like that's still traumatic for them.
Yeah, it is. Absolutely. It's kind of this big buildup and then nothing happens, right? Which of course we're thankful for, right? We don't want complications for our birth or afterwards, but you're absolutely right. It's this feeling, it's this buildup, and then you have all of this, and where does it go? Right? It's still inside of you. And so that is where I would encourage some of these movement-based or body-based therapies, dance movement therapy, craniosacral therapy. One of the cool things about dance movement therapy is that it has a goal of completing a cycle. So to give a very easy to understand example with trauma, let's say that you experienced a sexual assault, for example. In that moment, all you may have wanted to do was push that person away, but you couldn't because they were stronger than you, they were bigger than you, whatever that was. And so your body, your hormones, your energy is like, okay, we're getting ready to push. And then we can't because they're bigger, stronger, etc. And so in dance movement therapy, you may have the opportunity to successfully push something away, whether that's a pillow or a ball or something, and allow some of that buildup of energy and emotions and hormones to be released from your body. So the same thing could be true with moms that have experienced polyhydramnios, is that they have all of this and then they don't know what to do with it. And so it's just kind of still there because nothing ended up happening from it, which again, a blessing. But going through something like dance movement therapy or craniosacral therapy can help move some of that energy and emotion out and allow that to kind of continue to flow in that cycle. The other thing I'll say, and this is kind of not traditionally therapeutic, but brain twisting about this topic. So just go with me for a second here. If you are incredibly anxious about your birth, and you're incredibly anxious about the health of your newborn baby after your birth, when you're pregnant, you're going to do every single thing that you can to make sure that your baby is healthy and that your birth is as seamless and painless as possible. You're going to be doing all of the right things. And so then you go through this birth and you have no complications. You go through the first year with your toddler, they have no complications. So if you didn't do all of those things correctly, there's a chance that you would have had complications, or that you would have, struggles with your toddler at year one. So in a way, maybe your anxiety is what helped all of these good things happen, helped you have no complications, helped you have a healthy toddler. And I'm not trying to say that that's always the case, or that moms who do something wrong in their pregnancy cause all of these things later in pregnancy. But for someone who's feeling all of this resentment towards the anxiety that they have, just looking at it from maybe that anxiety helped you. Maybe it was good that you had that because it made you do all the right things to get to where you are now. That could help relieve some of that. And again, I want to reiterate, I am by no means saying that a mom who doesn't do everything perfectly during their pregnancy caused or deserved or anything a negative birth or negative complications. But again, just a little brain twist might help see some of the benefit of that anxiety in a mom that's resenting some of that anxiety that they had.
I love it. I love it. It's like bringing in a new perspective, right? From these thoughts that we have that can consume us.
And I love the way you describe that as building it up and just holding it, not having a way to just release it. That is so perfect. Such a perfect way to describe it.
I feel like we're moving into this area of like after the birth, right? The postpartum. So, some of our mothers, have to deal with some really difficult scenarios on the other side, having to do with, their children come out and they might have unexpectedly raising a special needs child, and something that they just didn't foresee. It is difficult. Myself, personally, I just had this image of like that I would have healthy kids, and it never even like dawned on me, and that I might be raising, a special needs child or someone or a child that's just, needs a lot of different help. It just didn't dawn on me. I just thought, I don't know, my husband and I were just healthy. Right. And so exactly. It's not going to happen to me. So, I've had, personally to cope with some of this stuff. And I know a lot of our mothers have to deal with anxiety and depression and guilt. I mean, really guilt, right? Like I love my child, but it is hard as well. And I know, from the little bit of therapy I've done, we can feel two feelings. I can feel guilt, and I can also feel, that this is hard. So how can moms and families help deal with these unexpected challenges that might have come up?
Mm-hmm, mm-hmm. Well, you said what was going to be my first answer, which is acknowledging that you can hold both feelings at once. You can feel guilt, you can feel even resentment for your child, and at the same time and in the same capacity, love your child unconditionally. You can feel resentment towards your spouse for not understanding exactly what you're going through, and at the same time and in the same capacity, love them and be thankful for them that they are there for you during that journey. This, of course, gets more complicated with, women who don't have partners that are supportive, or maybe they don't have a partner at all. They're on this journey alone. There's so many layers here that can go into overwhelm. I mean, again, not a mother, but I know a lot of mothers, and I know that having any baby, whether it's a special needs baby or a non-special needs baby, it's a lot. It's a lot of work. It's a lot of time. Your body is healing. Your hormones are doing all sorts of crazy things, regardless of whether you had polyhydramnios or not. Like that's a lot to handle. And so again, just to reiterate what you said, Megan, that first thing is be aware of and accepting of the fact that you can hold these contradictory emotions, and that feeling guilt or resentment does not make you a bad mother. It does not make you a bad spouse. It makes you human. And I hate to break it to you, but we're all human. So that would be my first tip. Yes, I know, right? The second thing is finding those additional support systems. So use what you have, right? But can you have a sit down conversation with your spouse and say, I am struggling in these areas and I need this type of support? Can you find a therapist? Can you find a sitter that has experience with special needs children that you would trust, so that you can go have a date night, so that you can go have a spa day, so you can go on a hike, whatever that is for you. But finding these other networks and communities and support systems, again, becoming involved in your organization, conversation and leaning on some of these other women who have been through this experience, it's not going to make that post-birth process seamless. It's not going to be easy all the time, but having that community, having those supports, being able to communicate what you need and not berating yourself for the feelings that you have, that is about the best you're going to be able to do in managing some of those emotions. And, you know, honestly, sitting down, yeah, I'll say this. So my story, again, I had, a career that I really wanted to do that because of some things in my medical history, I was not able to do. I was immediately disqualified, couldn't even try. And it's not exactly a loss. It's not anything necessarily like raising a special needs child, but I had to grieve that. And I had to grieve the life that I thought I was going to have. And honestly, that's something that I'm still working through some days. As a mom with a special needs baby that maybe they weren't expecting, they kind of have to grieve the life they thought they were going to have. It's going to look different. They're going to not be able to do some things that they were, you know, planning on being able to do. And so again, acknowledging and honoring that grieving process and allowing yourself to grieve for the life you thought you were going to have is a completely valid thing to do. So really bringing awareness to those feelings, acceptance of those feelings, and then tapping into some support networks that you have is going to be the best tips that I can give for moms who find themselves in that position.
I love that. And I want to give a plug too, that some of these infant and toddler special needs programs have therapists that specialize in working with families who are learning to manage a special needs child and how that fits in and how they can help cope. So these resources are available and through every state. So I say, definitely look into those routes as well. So Tiffany, I'll let you go take over from here.
Okay. Yeah. So we've been talking a lot about moms going through polyhydramnios, but we want to not forget our physicians too. So we wanted to switch over to them really fast. You know, the president of our board, Dr. Aziz, he has mentioned to us before that sometimes he finds it, he's a maternal fetal medicine specialist for anybody that doesn't know. So he sees polyhydramnios a lot in his practice. And he told us that one of the very difficult things that he finds in his practice and with other OBs is, how do you know which patients can handle which amounts of information? So do I tell this mom everything? Or is this a woman who only needs, you know, less is more? And maybe if you gauge that wrong, having to deal with the fallout of that, or watching your own patient dealing with the stress and the struggles in her own mental health. Do you have any advice for our physicians or our healthcare providers going through this stuff?
Yeah, I'm so glad you brought this up because it's so true. I mean, yeah, sure, there are probably some doctors who got into medicine because they like wearing a stethoscope or something. I don't know. But for the most part, doctors get into medicine because they care and they want to help and they want to make a difference. And when they see a patient over a long period of time, like an expecting mother, they become connected to them. They become invested in their care. They want to, you know, make sure that this mother and child are as happy and successful and healthy as possible. And to see them struggle can be so difficult and so painful. So first of all, I'm so glad you brought this up. It's such an important topic. For any doctors and physicians that are out there, a lot of what I've said already absolutely applies to you as well. Acknowledging that what you're feeling is totally okay to feel. It can be tempting to be like, again, getting in that comparison game of, okay, I'm not even in this family. Like, this is not affecting me. This is someone that I kind of sort of know. I should not be feeling this way. I should not be this stressed out. I should not be this upset. I shouldn't be crying after they leave my office. But giving yourself that permission to say, you know what? No, I have a heart. And I care. And that's an awesome thing. And sometimes that means that I go in the supply closet and I cry after a certain patient leaves. So giving yourself that permission to feel and not compare your pain to the mom's pain, to the spouse's pain, to anyone else's pain in the world is going to be really helpful. Additionally, tapping into those networks. So can you talk to your colleagues? Are there support groups for physicians out there? Hint, hint, there absolutely are. Can you see your own therapist and just explain how much you're dealing with and how much you're seeing? There's actually this concept, well, there's two concepts that are kind of similar, but compassion fatigue and secondary trauma. So compassion fatigue is felt by helpers in any capacity, whether that's me as a friend to Tiffany, helping Tiffany out, or a doctor helping a client, anyone in that range, where they are giving so much compassion and empathy that they become exhausted and they're kind of burnt out from caring so much. And then secondary trauma is found in careers where you are witnessing a lot of trauma. So firefighters, police officers, ER docs, different things like that. And you will actually start to exhibit and feel signs and symptoms of trauma, kind of like an accumulation. So like if you experience the trauma directly, maybe you get 10 units of trauma. But as a police officer, you see 10 traumas that you get 1 unit of trauma from each. Now you're feeling trauma as well because you got a cumulative amount of trauma. And so those things, compassion fatigue and secondary trauma, again, very, very real. There are support groups, there are therapists that focus on first responders, on frontline workers, on people that are experiencing this compassion fatigue and secondary trauma. So reaching out to those networks and support systems, finding someone to work with to help you manage all of that, because you as a physician, you're carrying a huge load. Those are going to be some really helpful things for, physicians that are having a hard time watching their patients that they care about go through something so difficult.
So helpful.
That is so helpful. I feel like I'm going to compare myself here and I shouldn't, but I even feel like sometimes I feel this just being in the position that Megan and I are in and watching the support groups and being supportive and listening to so many different women's different stories. I feel like I take those on sometimes too much or more than I should, but it's okay to feel that way.
Yes, absolutely. Absolutely.
So I feel like there's one area we want to make sure we don't forget about. So we've talked about, the moms and the babies and the trauma and the physicians. And that is, there are other family members that are here and being affected by these scenarios. So we want to know, how is it different to be a person watching trauma unfold versus the person that it directly happens to? And what tips do you have that can help those around us who are also affected by our experiences? Like my partner and I, we have great communication, and I will say it was still challenging. It was still very challenging. And we do all the things, we are self-care advocates and therapy and all the stuff, and we still struggled. So I'd love to hear your suggestions on how, it affects us differently and how we can navigate those waters together.
Absolutely. So there's a couple different things I want to touch on here. The first of which is this concept of kind of areas of effect or effect size. So there's the mom, who's obviously very, very directly affected by this diagnosis. Then in kind of the next ring is the partner, any other kids that are in the household, anyone who is living and directly against or with or next to this mom who is experiencing this diagnosis. And then moving one out is everyone kind of watching and looking in. So that could be friends, other family members, support groups, different people like that. And all of those different individuals, the mom, the other family members, and then kind of everyone else, they're all going to have different reactions to this situation, not only because they're all individuals and individuals have different reactions, but because of their level of closeness to, I guess, the epicenter of the trauma in this case. So starting with the family members, number one, if you have other kids in the family, it is so important to, number one, be open and communicative with them. And number two, make sure that they are still getting attention. They can't just be neglected, forgotten about to focus on this baby that is currently being carried. So whether that looks like, if they're old enough to understand, having a conversation and saying, hey, this is why mommy needs to be in bed all day. This is what could happen. This is why it's really important. And kind of having a modified conversation, like I gave earlier, of this is what I need in this moment, and this is how you can help me and be a part of this journey. With the spouse, again, making sure that they are still feeling loved and supported, even though you need a lot of love and support from them, but having those open lines of communication. This is super cliche, but using I statements is so, so helpful. And I'm sure that everyone's heard it, and I'm sure that everyone is like, yeah, whatever. But it is so, so critical in the way that you phrase things. Because if I come up to someone and I'm saying, hey, Bob, I really need this right now, can you help me make it happen? Is going to be so much better than saying, Bob, you didn't do the dishes again, right? You did something wrong versus this is what I need from you. Not only do I statements place the ownership and any negative energy on you, but by also saying, hey, I need this, you're inviting this person to become a part of your support system and a part of your journey. So instead of ostracizing and saying, you're doing this wrong, you over here are doing this incorrectly, you're saying, hey, come with me, and this is what I need from you in this situation. So that's just one quick communication tip, but it's so, so important. And it can go downhill so quickly when it's, you did this, no, you did this, no, you did this. And it's just, it goes downhill from there. Another thing with spousal or partner communication is the you versus me versus us versus the problem type of paradigm. And this is very common in couples counseling for all types of situations. But if I'm sitting here and my spouse is sitting there and we're facing each other talking about a problem, that is me versus my spouse, right? We're against each other. One of us did something wrong, and there's that conflict there. But if we can literally turn our bodies so that we are next to each other and we have the thing that we're focused on, that's the problem, out in front of us, whether that's metaphorical or we literally write it down on a piece of paper and stick it on the table. Now it's my spouse and I together versus the problem that's out here. And that is such a major dynamic to change within a relationship, because again, me versus you, we're not getting anywhere because we're just going to be yelling and screaming and hating and crying, and it's just going to go very bad. But us versus the problem, I'm going to bet on us as a team because we can solve this problem. So that's just another dynamic change that can be really helpful. Moving out to that next circle of friends, family members that are looking in, there's a lot of things that can be done to support those people who may also be affected. But the biggest one that I can share is a concept called holding the space. Have you guys heard of that before?
No.
Okay. So this is one of my favorite things in the world. It is the most beautiful thing that you can do to support someone. It's also the most difficult, and I'll explain why in a second. But there's a woman named Heather Plett, and she quite literally wrote the book on holding the space and what that means. And she says, I'm going to try to do this quote off of memory right now, but holding the space means being willing to walk alongside another person in whatever journey they're on without judging them, making them feel inadequate, trying to fix them, or trying to impact the outcome. When we hold space for other people, we open our hearts, offer unconditional support, and let go of judgment and control. And when you sit with that quote and really understand what that means, that it's going to be the best thing that you can do for someone. So what that looks like from a realistic situation is oftentimes not saying anything, sitting there with that person, being there with that person, letting them know that you're there, letting them vent to you, letting them cry on you, letting them ask you for how they need help, and then providing that help for them. A lot of times where we go wrong is I'm a fixer and I will own it right away. If someone comes to me with a problem, I'm like, okay, solution A, solution B, let's make it done. Let's make it happen. And that can feel really overwhelming and overpowering when you're going through something traumatic. And so squashing that desire, and instead of saying, here, let me help you with this, let me fix this for you, sitting with them and saying, what do you need? How can I help? And listening and then doing what they tell you to do can be so difficult, but it's so, so important. And that's the best thing that you can do for them. I'll end this by giving this one example. It's actually a story that was told to me by a woman named Sally, who is a dance movement therapist. I'm sorry, not a dance movement therapist, an equine assisted therapist. And this is the story of a day she was working on the farm with a young client. And this little girl looks at her and she's like, Sally, let's go hide in the dumpster, because they were playing a game of hide and seek. And Sally's like, okay. So they go and they get in the dumpster, and it's a dumpster, right? It's dark, it's smelly. There's something dripping over their shoulder. It's not a fun place to be. And this little girl looks at Sally and she's like, hey, Sal, this is kind of like life, isn't it? And that moment hit Sally so hard, because for that little girl, that's what her life was like. It was dark. It was not a fun place to be. And she couldn't just get out of it whenever she wanted to because of her mental health struggles. Sally could have gotten out of the literal or proverbial dumpster whenever she wanted to, because she was not the one struggling with her mental health, nor was she really the one playing hide and seek. But by choosing to stay and by choosing to sit in the darkness with that little girl, she was effectively holding the space for her. So that was a very long answer there, but those are some really good tips that I can give for supporting people that are kind of around the mom who has just gotten this diagnosis.
That is so beautiful. As someone that is a fixer myself, working to not try to impact the outcome. I mean, that one, you listed several, but that one, I'm like, well, I thought that's my job to try to impact it, but you're right. It's just to listen. It's just to hold the space. That was beautiful.
Yeah, absolutely. So you already kind of addressed our very last question that we had. But if you have anything else to add, we were just wondering, what are some really good ways that any of us can help support someone as they're going through trauma? So definitely holding the space, because that was brilliant. And
yeah,
if there's anything else, we'll let you add it.
Yeah. So there's two other things that I would share. And this is what I talk a lot about in the presentations that I give. Number one is validating their emotions. So I hate using the C word because I don't think anyone is ever truly crazy. But when you're going through a trauma or you're healing from a trauma, at least for me, crazy was on a loop, along with a lot of other insults in my head. I felt like I should have better control over my feelings. I felt like I shouldn't be feeling the way that I was, like, we talked about earlier in this discussion. And it's so helpful if you as the support system are able to come in and say, hey, everything that you're feeling right now is perfectly okay to feel. You are not crazy. You are not broken. Everything that you're feeling right now is perfectly okay to feel. That's not going to prevent them from ever thinking that they're crazy again. But what that can do is give them a split second of clarity where they can say, oh, okay. It's okay to feel this. It's okay to feel this. And then have the wherewithal to use some of the coping mechanisms and strategies that they've already learned in their healing journey thus far. So reminding them, you're not crazy, totally okay to feel this way. That's thing number one. Thing number two is treating them as normally as possible. Now, I don't mean that you bury your head in the sand and pretend that their trauma didn't exist and we're not going to talk about it and things like that. But I don't know if this has ever happened to you, but when I was healing, I would walk into a room of some of my friends and everyone would go quiet. And then after a little while, one person would be like, Jessi, oh my gosh, I'm so glad you're here. Have a seat. Let me get you a drink. Here's some pizza. Do you want a different type of pizza? Are you too cold? Should I turn up the like over the top? Right? Trying to be there, trying to be supportive. But all I felt in that moment was different. Like I was an outsider, like I wasn't normal anymore. And so if you're able to treat someone as normally as possibly by continuing to invite them out to social events, even if you know they're going to say no, continuing your Sunday morning coffee date, like whatever that looks like for you, you're going to allow them to retain a sense of normalcy in their life during a time that otherwise can feel very, very painfully abnormal for them. Of course, be there for them if they need to cry about whatever they're going through, 100%. I'm not saying pretend that their trauma doesn't exist, but you don't want to treat them like they're broken, because that's only going to validate everything they're feeling in their own heads and not give them an opportunity to be a human and to live and to have some of that hope and faith for the future. So those are the other two things that I would add to my whole monologue about holding the space.
Wow. This has been such an amazing hour. It flew by. Like, wow. Here we are. And I personally have picked up so many different tools and so much different help. And I'm going to listen and hold the space better after this call. So Tiffany, I'd like to hand it over to you.
Yeah. Jessi, we so appreciate your time and your effort. And I just love your heart for people going through any kind of trauma. I took so many notes today just for myself. And I think this is going to be so great for our community. We are so appreciative of you doing this. We want to make sure everybody knows to check out Jessi's site. It's How to Heal Co. or CO. Yes. How to Heal. It's not company, just co.com. Yes, and also, if you enter our giveaway, then you get a free ebook, or you can buy this book on Amazon too. And it's totally worth it. It's absolutely amazing. Jessi, thank you so much for your time and for being here.
Thank you so much, Jessi. We're so excited for our community to view this. So thank you for your time. We know it's so valuable.
Thank you guys so much for having me. I love sharing this information. And also, just to turn it back around to you guys, thank you for doing the work that you do. I will be very honest, I had never heard of polyhydramnios before we connected, and just knowing how much you give to your community and how big of advocates you are in helping raise awareness of this and provide resources for families that are affected by it. I am just so thankful that people like you exist for anyone who is going through something like that. So thank you guys too for the work that you do.
Oh, thank you.